Assalamu alaikum and good afternoon, everyone. On behalf of the Center for Global and Strategic Studies, I, Minahila Fidi, welcome you all to this webinar on COVID-19 Chronicles, a Woman's Perspective. We are honored to have the participation of remarkable women from different countries who will share with us their perspective regarding the current situation of women amid COVID-19 pandemic. The concept behind this initiative is that this pandemic is not only having serious health consequences, but also serious social ramifications. Under these circumstances, women around the globe are facing many challenges, including domestic violence, health concerns, financial pressures, and excessive burden of household. Thus, there is a need to create awareness among women to utilize this time to engage in constructive and healthy activities. And for this purpose, we have invited leading women from Pakistan, China, Uzbekistan, Kazakhstan, Kyrgyz Republic, Azerbaijan, and Uzbekistan to discuss their perspective with us. I would like to invite Ms. Mehreen Gul, the Director of Center for Global and Strategic Studies, to please deliver the opening remarks.
Thank you very much, Ms. Minahil. Bismillahirrahmanirrahim. Assalamu alaikum and greetings to all. I'm pleased to welcome you all to our webinar today. It is truly inspiring to see so many women on our panel today, and I believe that this is the perfect platform for women to talk about and to give their views about this current situation, the COVID-19 and the lockdown and its effects and impacts. Today's webinar brings together so many women from the diverse background and different countries to discuss how COVID-19 has affected them. Their jobs, their businesses, and overall their life. Being in Pakistan, yes, I can discuss the situation that how COVID-19 has impacted the women sector, especially if I talk about the rural areas. Almost 22.3% women are associated with agriculture sector. They have been impacted badly. In addition to this, if I talk about urban areas, women who are running their small businesses, women who are related to all these activities, they are suffering, they are facing the obstacles in this current situation, especially if I talk about the educational institutes. Almost 70 to 80% women are in educational institutions, in schools, in colleges, in universities, and in this time this is very difficult to manage as kids are not going to schools, like overall burden is getting increased. But today's webinar purpose is to share views that how we can curb this situation, how we can present some recreational and constructive activities, because women, and if I talk about the Pakistan situation, 70% of women are contributing in front lines, including female doctors, and female paramedical staff, nurses, also volunteers, as university students, female college students, all are participating to contribute to help in this situation. Globally, the rise of the problem faced by women during mandatory lockdown measures has even led WHO to acknowledge the impact of COVID-19. Like all the major institutions, WHO, UN Security General, all are emphasizing to for the efforts of women, because they are associated with almost every sector of the society. The pandemic has deepened the social, economic, and political inequalities for women. So I think that this is the best time to represent our women on every field, as Center for Global and Strategic Studies has presented this webinar for exclusively for women to share their views, how we can move towards the reopening and how we can participate in decision-making committee for government, not only for government, but on our second tier. So I think this is the right time to contribute. Thank you.
Thank you so much, Ms. Mehreen. Now I would invite our first speaker of the session. Our first speaker is Ms. Rama Chima. She is communications, media and marketing professional and has a vast experience in the diverse fields of media, public administration, and advocacy. She has also worked as the media consultant for Women Development Department of Punjab Government, Pakistan. She is the founder of Beti, a media and advocacy program aimed at elevating the social and economic status of girl child and women. Ms. Rama, please enlighten us with your remarks on advocacy in COVID-19 and everyday challenges faced by women during this pandemic. Thank you.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum to everyone. It's very nice to see that the panel just doesn't consist of women, it also consists of men. Because whenever one has to make any policy or any decision making, I think both the gender have to support each other. And it's nice to see men participating in this session also. I'm very grateful to CGSS for giving me the opportunity to raise certain reservations that I have with COVID and the challenges that I feel women are facing. And I think there is always a unified approach. Such incredible women from Central Asia, China, I think it just makes you feel that there's a sense of unity in the problems that we are facing, and perhaps we can learn from each other's experience, because obviously, you know, as women, all of us have gone through our share of challenges. I started Beti about a year ago, but it was something that I had grown up with. I didn't have a brother, and I was always, I kind of felt that I wasn't good enough, and I belong to a family that works on agriculture, and it became more apparent as I was growing up that my freedom was completely dependent on others. My voice, my opinion was completely, the decision making was always taken away from me. And since, like I said, it's something that I've harnessed for a very long time, and most of my work in the media and the government and even academia is somehow connected to gender. So I launched Beti about a year ago with the thought that I always felt that there has to be social elevation. You have to treat your daughters, your sisters, everyone right. And unfortunately for us and the entire world, COVID has posed certain challenges that are very unique. You know, it is sad to see that domestic abuse in Pakistan, in the region, even worldwide, has risen, and the number of incidents has risen. There is all kinds of abuse. Now, abuse and violence doesn't mean that there's going to be physical violence towards you, emotional violence, bullying. That's all part of making you feel unworthy. And you know, there was always an existing inequality in terms of gender. But now with COVID, I think the situation is very, very challenging. As I said, there needs to be health equity. There needs to be a sense of protection for the vulnerable. And, you know, I know that anyone who does get COVID, there's a stigma attached to them. Nobody wants to meet them, even when once they, you know, women and young girls, they say they are free of the virus. There is a stigma attached to the family and people, even though, you know, WHO or the government, there have been, the media is telling you that once you don't have the infection, you are safe to interact. And I think there's a 14-day quarantine period after the infection, after the virus takes over your body. Now, during COVID, a lot of women lost their jobs, especially women with small businesses, women in beauty salons. And, you know, I don't know if they can ever get back to their feet. And, you know, you hear these stories where they've had to go back to their villages, which is where they've come from, to bigger cities. And, you know, reproductive health is another area which has suffered because the maternity wards all over Pakistan have closed down, which basically means women don't have access to maternity health. And of course, you know, there is going to be a rise in population also. So that is something that, the government and the civil society needs to be mindful of. I would like to share a few numbers that were taken in 2017 and 2018. Only 39% of women have access to internet and mobile in Pakistan. Only 97% of women and young girls have a share in their inheritance. Only 34% of women and young girls are included in decision making. So if I'm allowed to work or not, if I'm allowed to get an education, what kind of career am I allowed to choose, if I'm allowed to choose someone for marriage. Apparently, I'm not the one who's making that decision, even if I'm an adult. Before COVID, the number of incidences of violence against women and those that were vulnerable was about 28%. And I know I still feel that's there's a lot more to that number, but the fact is that not every case is reported or registered with the authorities. So what do we do in times like these? On Beti, I see a lot of women reaching out to me for help. They're having a hard time, or they've lost their jobs, they don't have access. So we can refer them to an organization that helps them. Now we can also provide, give them referrers or connect them with lawyers that can help. Legal help is also there. And in Punjab, I think PCSW has a helpline, and Human Rights Commission in the federal government has a helpline. NGOs are working towards it. And as you guys already mentioned, WHO and UN Women and different organizations are working towards it. However, I think the support system has to come from me and you also individually. And we should be, I know that I'm sure somebody's going to talk about the psychological effects of COVID on all of us, but we need to be a support system to each other. We need to understand that it's a very challenging time for all of us, and we need to show empathy where we can. And other than that, I think on a personal level, what I felt is that, as a working mother, a lot of pressure falls on you. You are not just responsible for running the house, you're also responsible for taking care of the family. So you're responsible for the cleaning, cooking, and having to sit down with the child for school. So there's a lot more responsibility on women everywhere, I feel. And also the thing is that nobody knows, there is no point of reference here. COVID just hit us. We were just pushed into our houses in isolation all of a sudden. And I don't have no reference to look at or how to make it work. And I think we're learning from things every single day. And again, my humble effort is to, through Beti and advocacy, is to provide a support system, and is to highlight whatever is going on, whether it's atrocities towards young girls and women, or whether there are success stories, to highlight those. And advocacy is only now, unfortunately, all I can do at this moment is digital advocacy through social media or television, or, because a lot of my work has stopped, mainly because I can't travel to areas and there are limitations. But I hope that such dialogues and community, this is a sense of community that I'm feeling today, that these help build networks, and perhaps some of you can share your experiences of how you're able to cope with what you're going through. Once again, thank you so much for the opportunity, Minahil, and Mehreen and CGSS. Over to you, Minahil.
Thank you so much, Ms. Rama, for this valuable insight. Our next speaker is from Kyrgyz Republic, Ms. Kana. She is the chairperson of the Kyrgyz Association of Women Police Officers. She is the professor at the Kyrgyz State University and author of more than 100 scientific and methodological articles and books on the history of international relations, modern issues of national security, women's participation in development sector, etc. Ms. Kana is also a member of the United Nations Program, Democratization in Kyrgyz Republic, and member of the Regional Association of Women Police Officers of Southeast and Central Asia. She has also served as the Deputy Chairman of the Public Council of the Ministry of Internal Affairs of the Kyrgyz Republic. Ma'am, I welcome you to this session and please deliver your speech on the topic Women of Kyrgyzstan before and after the COVID-19 pandemic. Thank you.
Саламат Спурмату Аймдар. Здравствуйте, уважаемые коллеги.
Good afternoon, our dear colleagues, and I'm so happy that I'm taking part in this conference.
Хочу поблагодарить организаторов конференции за столь представительный состав и очень интересную тему.
And I think that this conference would be so interesting for every woman and for everybody.
Женщины в Кыргызстане до и после COVID.
Women in Kyrgyzstan before and after COVID-19.
К сожалению, презентация по техническим причинам у нас пока не появляется.
We are sorry that we couldn't illustrate our presentation.
Но
we will tell it orally.
Доля женщин в населении Кыргызстана составляет более 50%.
The share of women in the country population is about 50.
Или на 1000 женщин приходится 984 мужчины.
There were 984 men per 1000 women.
Среди заболевших на сегодняшний день женщины составляют более 52%.
The ill women of the COVID is about after. Upper than 52.
Женщины трудились на всех участках в сфере здравоохранения, образования и социальной безопасности.
Women worked in all sectors. They worked in the military, in government office, and it's in medicine.
Женщины государственные служащие занимают более 40%.
Women in public office is about 40.
Положение женщин в Кыргызстане при COVID-19 характеризуется тем, что перегруженная система здравоохранения, образования, где большинство составляют женщины, привело.
The situation of women during COVID-19 over the past year, almost 1 in 5 women in the world has been abused. Currently, many of these women are at home with that assures as if in a trap, trying firstly to gain access to cut-off and limited services.
Раньше говорили о тройной нагрузке женщин, но во время пандемии она возросла в разы.
In Kyrgyzstan, the number of cases of domestic violence in the first quarter of 2020 increased by 65 compared with the same period last year. Domestic violence is not only beating and in the new year. Seven women were killed due to domestic violence. In emergency, more domestic violence doubled.
За последний год почти каждая пятая женщина в мире подверглась насилию. В настоящее время многие из этих женщин находятся дома вместе со своими насильниками, отметил генеральный секретарь ООН Антонио Гутерриш. В Кыргызстане количество фактов домашнего насилия за первый квартал возросло на 65% по сравнению с тем же периодом прошлого года. Домашнее насилие в режиме чрезвычайное положение, семейное насилие выросло вдвое.
Just a moment, please.
Чтобы сэкономить время, я хочу сразу предложить, что можно сделать.
What needs to be done to decide this problem?
Для этого прежде всего необходимо, чтобы женщинам были предоставлены равная представленность, равные полномочия на принятие решений.
The interests of women and girls should be at the heart of policies that determine plans and ability during a pandemic.
И сегодня, наверное, все участники конференции согласятся с тем, что интересы женщин и девочек должны быть в основе всех решений, определяющих планы и реальность во время пандемии.
Raise awareness of women about activities and ways to seek support, both with men and boys to remain gender stereotypes.
Мы столкнулись с тем, что необходимо повышать осведомленность женщин, подвергшихся насилию, о возможности и способах обращения за поддержкой.
They work with social pressures, ensure equal representation and improvement of women at decision-making level. Thank you for attention. We are sorry that we couldn't yesterday our presentation. Thanks.
Thank you so much, ma'am. Now we'll have with us Dr. Rafia Rafiq. She's an associate professor and currently serving as the director, Institute of Applied Psychology, University of Punjab, Lahore. She has been awarded the National Talent Scholarship and her name is published in the Encyclopedia of High Achievers of Kennett College, Light, Courage and Love. She completed her postdoc from United Kingdom and she has the honor of supervising first indigenous postdoc in the field of psychology in Pakistan. Thank you so much for joining us, ma'am. Please share with us your valuable insight on mental health during the pandemic.
Thank you very much, Manahil, and thank you, CGSS, for inviting me for this talk. I have a PowerPoint presentation. I will try to share, Manahil, if I'm unable to, so you have got the presentation too, okay?
Yes, ma'am.
Is it visible?
Yes.
Yes, ma'am, it's visible.
Okay, so everybody is talking from their own perspective, being a psychologist and being in this field for the last 20 years. The most important thing was that when the pandemic started, what I said was that this pandemic is going to end one day, but the long-term psychological effects of this pandemic are going to stay for many decades. So my mission was to take up the mental health issues, especially of women, because they were the ones who were more vulnerable. I will be discussing how women redefining life for women, mental health during the pandemic. So COVID-19 pandemic, you all know that it took over the world like a magical spell. In matter of days, so many countries got affected, lost lives and livelihood, and there was no time, in no time, the world's economy started to collapse. The worst time of 21st century medical psychological emergency started being witnessed on daily basis. And the first cases reported in Pakistan were on 27th February 2020. So we woke up in a new world, or totally new world. It was an international media that played its role, and national media exposed its viewers to all sorts of images, from coffins in Italy to all what not. People who were not able to audit their media diet, they fell prey to negative emotions and psychological concerns. Women got affected the most. So working women got burdened the most, and even the UN Secretary General also said that I urge governments to put women first, safety first, as they respond to the pandemic. So as the pandemic of COVID-19 continues to spread in Pakistan, it is necessary to recognize immediate as well as long-term psychological needs of women. So having not been used to sitting 24 hours at home, including myself, was frustrated and bothersome for many working women. So additional responsibility of caring for the sick and the elderly added to their domestic workload, not to mention the workload due to the extended families in which Pakistani women have to live and survive. So managing online classes for their children was reported to be one of the major stresses, because nobody was prepared, neither the students, nor the parents, and nor the teachers. So deadly impact of lockdowns and quarantine on women in Pakistan, there was rise in domestic violence, as already one of the participants has talked about women were best at home and exposed to the abusers for longer periods of time with limited options to access essential services because of lockdown. Women started becoming target of sexual partner violence and other gender-based violence, and clinical management and psychosocial support was harder to access during this lockdown for women already facing mental health challenges. More female health workers at the front line, male dominated. Still, the decisions were dominated by the men at the task force. And when women and girls are locked down in their homes, they are at much greater risk than ever before. So it was women were not just victims in the crisis, they played a major role in COVID-19 response. It was time to pay back, and universities in Pakistan played their role during the global crisis. Mental health services were started by many universities, including our own university and my own department. We were the pioneers in starting the psychological and mental health services, and our students and our professionals, clinical and health psychologists rendered their valuable services in telemedicine centers also. So this is some of the data I wanted to share. There was an influx of callers on our mental health helpline, and among these callers, 69% were women. And the major issue they were facing was anxiety, then followed by sleep disturbance, then depression, and anger and aggression issues were reported by these women, and stress was obviously there. So if we look at the data that of the callers reporting at our mental health helpline, these females reported the major problem reported by these female was fear of catching the virus, fear of not going back to their work, and there was a varied reasons for this fear. It was followed by sleep disturbances. A number of women who called at our centers, they said that they were facing sleep disturbance. There was anxiety issues, there was anger, and then there was sad mood, panic, marital discords, though they were not directly reported to us, but when we used to interview them and when we used to do counseling with these women, they used to tell us that usually they were stressed out because of the marital problems going on at home, because everybody was sitting there and everybody had, most of the people at home, either they were working from home or they were not working at all. So violence was another thing that was indirectly reported. And we started these services with the name of COVID-19 Mental Health Helpline. And our major focus was to manage problems like anxiety, phobias, obsessions and panic, sad mood, stress management, anger management, educational concerns, sleep disturbances, and also our focus was on healthy lifestyle, how we can teach these women to involve themselves in healthy lifestyle. So there was a role of women psychologists in mental health telemedicine that was much needed because we could not physically sit and counsel the clients that were those who were reporting. So if we can see that the data from a telemedicine clearly depicts that there were two age groups of women who were mostly affected. First age group was those between 18 to 25, and they reported that they were suffering from anxiety, and women 45 and above. They reported that they were facing a number of psychological issues, including violence and sleep disturbance and sad mood. So women got together. Women in Pakistan got together, clinical psychologists from all over Pakistan. We united hands. We held a conference. Basically, the purpose of this conference was to design a protocol for volunteers of mental health helpline in wake of coronavirus. So women came forward, and then there were many women from academia, our psychology community, who conducted these online training sessions. And then there was an appeal for peace in homes around the world, because we started getting calls related to a number of family discords, family issues. And so we had to focus on these things. Then we wanted these females, because many of them were in the emotional exhaustion state. So they were reporting that they were mildly depressed. They did not want to continue with any household work. So we wanted some hope for life. So there were lectures, there were seminars and webinars, and psychology community stood up. And we thought that we should address the needs of the callers calling at our helpline and telemedicine center. So we held a number of webinars concerning with women's mental health and well-being, mind refraining and mindfulness to manage pandemic, finding true lasting happiness amid difficulties, how to build a positive home environment, dealing with grief and loss, because we started receiving calls in after around in May, when the female callers used to call and said that we have lost someone in our family, how can we cope with this? So we thought we should do some webinars on this, how to cope with grief and loss during COVID, and then CBT for frontline female workers, our female colleagues who were basically going to the hospitals and working there. So myself, I started a video message, 1-minute video message series, in which I wanted that people should stay positive during this lockdown. And for the females out there, I used to give little messages like, give yourself quality time, me time, all beautiful ladies out there, pamper yourself for just 15 to 20 minutes. And there were then other messages like, forgive others, reduce the clutter in your mind, or audit people from your life. It is if they are giving you constant stress. So there was a series of 1-minute video series for lay women to women who were educated. And I got good feedback from these women. They felt that they could feel the positivity through these messages. Then we ran short programs to educate women dealing with anger during pandemic, because of anger, because of the workload, and because of the extended family, and people were not cooperating with them, their husbands. So we wanted, okay, we should psycho-educate these women how to control their temper, how to control anger, how to cope with corona anxiety, and then how to stay happy and positive during pandemic, how to manage conflict with your partner during lockdown, because this was another concern that was reported multiple times by these callers, that they were facing difficulty in maintaining and sustaining healthy relationship with their partners and their families. Meanwhile, we started losing our psychologists and our female colleagues from our psychology community. That was quite a phase in which there was a steep rise in number of cases in Pakistan. And on 16 June in Pakistan, around 111 die over the past 24 hours. So the number started increasing. It was basically after the Eid, and people stopped abiding by the SOPs. So in fact, the corona was a real threat, but not for some women. They were out shopping there for the Eid and everything for the festivity. So we did a little survey in order to find out what were the reasons that the corona was there, people were dying, but still, why were they not abiding by the SOPs? So 45% of the women reported that emotional and religious reasoning. They said that no matter if it is destined to happen like this, we are going to die. So why should we abide by the SOPs? And then 16% were minimizing the impact of coronavirus. They said that it is just a flu, and most of the people don't end up having the respiratory problems. Then 11% reported that it is not my free will that I should follow the SOPs. My family, my husband, they are not following, so I cannot follow. And 13% of the women reported, actually said that they do not believe that corona was there. It was just in media. So these were the interesting responses, and 10% reported that they were emotionally exhausted because of this pandemic, and because they were not aware when this pandemic is going to end, what was the timeline. So they said that we are done with it, we cannot follow the SOPs. 5% of them were saying that it is just like any other outbreak, and these type of outbreaks come and go, and it is not important that they should follow the SOPs. So psychologically, if we consider all these responses, usually spending time with people who feel the same emotional stress, it basically lowers our cortisol level and reduces our stress. Then it was a real challenge for us to cognitively reframe the thoughts that were in the mind of these women. Like, my friends and I cannot see each other. So we told them, my friend and I are protecting each other. So the counseling sessions focused on cognitive reframing during this social isolation. Then we started media awareness campaigns, COVID-free Pakistan, for masks, for hand sanitization, for physical distancing, and things like that. Excuse me. So my message would be that ensure that women and girls have access to COVID-19 public health and mental health messages. Pay explicit attention to psychological well-being of women and frontline workers, as women make up 70% of healthcare. Stepping up advocacy and mental health awareness campaigns, including targeting men who are sitting at home. We need women at the table when healthcare decisions are taken on this pandemic. With women's mental health protected, we can get through the pandemic faster and build more resilient and productive communities. Thank you.
Thank you so much, ma'am. I would now introduce to you our next speaker from Azerbaijan, Ms. Negar. She is the advisor of the International Relations and Protocol Department at the State Committee on Work with Diaspora of the Republic of Azerbaijan, and the project manager of the Chamomile Azerbaijani Diaspora Women's Network. She has a bachelor's degree in accountancy and audit from Azerbaijan State University of Economics and holds a master's degree in finance and accounting from United Kingdom. Ms. Negar, please share your views with us on the topic, positive and negative influences of the COVID-19 pandemic on the life of a woman.
Thank you very much, Minahil. First of all, I would like to thank the Center for Global Strategic Studies for organizing this international webinar. The issue that we're talking about today is beyond important, and I'm happy to have an opportunity to learn from your experiences and share my own point of view. First of all, I would like to start by introducing myself once again. I'm Negar Jamshizadeh, advisor of the International Relations and Protocol Department at the State Committee on Work with Diaspora of the Republic of Azerbaijan, and a project manager of the Chamomile Azerbaijan Diaspora Women's Network project. Due to the COVID-19 lockdown and social distancing measures, we decided not to postpone the implementation of our intent till the normal times and launch our network project online first. The mission of the Chamomile Network is to establish a solid Azerbaijan Diaspora Women's Network by empowering Azerbaijan diaspora women. It's a knowledge sharing platform, a platform where diaspora women can share their experiences, learn from the best practices, and receive support to fulfill their potential. As in any other country around the world, COVID-19 has had a negative impact on Azerbaijani society as well as on women in particular. When I talk about negative influences, I mean the influences on both private and social lifestyle. This is a very broad topic and we can talk about it for hours. But since today's topic is about the effects of COVID-19 on women in particular, I would like to share my thoughts on this with you. First of all, I would like to know that there is a considerable number of business women in Azerbaijan and their areas of activity are very wide. Various areas of production, both perfumes and jewelry, food industries, bakeries, etc., service areas, beauty salons, health centers. Of course, during the quarantine period, the activities of the vast majority of them were stopped, depending on the area, and all these areas are directly related to each other. So even the income of those female-owned businesses that are still active has fallen significantly. The Azerbaijan state provided support to all sectors of economy. This is not something that every country can do. Special mention should be made of the extensive activities carried out on behalf and under the direct control of the President Ilham Aliyev, aimed at providing state support to all sensitive sectors of the economy. This includes measures to protect jobs, provide financial support to individual entrepreneurs affected by the coronavirus pandemic, as well as to reduce the tax burden on entrepreneurs by providing tax breaks and, most importantly, provide direct social support to the population. In Azerbaijan, we also have a large number of housewives. Of course, their workload has increased many times and their responsibilities have increased significantly. This includes house chores, family, childcare. If we look at the life of any housewife, if in the past their spouse was at work and the children were in the kindergarten or at school, now everyone is at home, and this is definitely the woman's concern again. So she's physically and mentally strained as the physical workload increases. It's also easy to observe. Of course, there are different families. There are families that help and support their wives, but this is a certain percentage. In spite of all this, I think that every woman, as a founder of the family, should be able to direct and manage her family properly. For example, meals should be given and the table should be set according to the schedule. Each member of the family should gather around the table, eat together. And when they get up from the table, everyone can help the mother to collect the table. If a woman managed to instill these values and understanding in her family, she won't need to prepare separate meals all day long for each family member. This significantly reducing the workload and at the same time, making family members experience how heavy the workload of the mother. Because in most cases, family members do not realize this. They do not participate in the process. They just gather around the table from time to time, unaware of where the blessings on the table are coming from. Here we have a positive side because family members spend more time at home during the pandemic. They may have easily witnessed the burdens that the motherhood and household placed on the woman's shoulders. This was just a small example of a culture around the table. It's possible to talk and discuss for hours about house chore worries. We came to the conclusion from this example that a woman should be able to set a schedule for the day for the family members to stick to and set aside a certain amount of time for herself, of course. This is not a skill for every woman, but for this purpose, various educational online seminars can be organized so that women learn to manage their time more properly. A woman should learn how to put herself first, because by doing so, she can sustain a healthy atmosphere in her house. A healthy and happy woman means a healthy and happy family. A woman should understand that being selfless won't benefit but rather will harm her family, because everything is on her shoulders and she has to take care of her well-being in order to be able to keep everyone around her safe and sound. I would like to talk about the pros and cons of the pandemic. There are women who got to spend more time with their children during the pandemic, what in turn allowed women to monitor children's online classes and even get to know their children better. But unfortunately, they cannot spend enough time with their children during the normal times while women go to work on a regular basis. Thus, a large proportion of working women usually entrust their children to a nanny and do not pay close attention to the daily lives of their children. This is not a good thing at all, because no one can replace the mother, and every woman should not forget that she is a mother in the first place. She should know that she is responsible for her child. From this point of view, many women I know have appreciated this opportunity, emphasizing that they spent a lot of time with their children during this pandemic period and that they were especially interested in their education. Not only children, but their husbands spend more time at home. I have witnessed a lot of progress in marital relations in many families I know. If before both of the spouses went out in the morning and came home in the evening and then spent time with their friends, since the husband and wife are at home, they have realized that they will be able to spend time together, watch TV together, play games with their children, and obviously there was more time to work on their relationships and talk through the stuff they didn't have time to talk about before. The husband and wife finally got some time to really bond with each other. Thus, we should not forget that there are pros and cons. We should be able to positively evaluate every situation we encounter. We should be able to manage our time properly. We should not panic. We should not only protect our family. We should always try to protect our mental health. Everything depends on the person, whether it's a woman or a man. We must be psychologically prepared and look for the ways to support those who are unable to do so. We must be able to be with everyone without forgetting about ourselves. If we learn how to be mindful, present, and at the same time distracted from the negativity, we will not be psychologically affected, especially women, because the family, children, of course, have a great need for us. Women must always be strong and not forget that there is no one else out there who can take on their roles and manage everything they do at the best manner. Due to the current situation, in order to achieve our goals as As a Originated Diaspora Women's Network, we organize online webinars where women can share their experiences and learn from the best practices without leaving the comfort of their homes. All the webinars are free of charge. Anyone can join and engage in the discussion. Our platform is educational. It is a place where women can bond together. In the future, we plan to continue our activities in the real-life manner, host events, gatherings, picnics, and etc. All that with the purpose of supporting women and creating opportunities for them. Thank you very much for your attention.
Thank you so much, Ms. Singar. Our next speaker is Ms. Faiza Sheikh. She's a qualified lawyer in the jurisdiction of England and Wales and a development sector professional. She has over 10 years experience as a lawyer in the area of civil legislation, predominantly family law, with a particular focus on social justice issues, including homelessness protection from domestic violence, protection from harassment, etc. Ms. Faiza, please enlighten us with your views. Thank you.
Thank you very much. Assalamu alaikum, good afternoon, good morning, welcome to my fellow speakers. It's an absolute delight to be here today. Thank you so much for including me. One of the things I wanted to touch upon actually was the fact that we're talking about women in particular and how they're dealing with it in the difficult times of COVID, etc. I had the privilege to some women who are working in a professional capacity as frontline workers, be it medical staff, be it people who are going out into the field and taking samples and so forth and doing screenings. And so I wanted to share some of their experiences. And interestingly, a couple of things I picked up on, which two of my other fellow speakers have mentioned, is Mehreen, that 70% of women are frontline staff. And Dr. Rafia had mentioned the emotional exhaustion and the issue of mental health. And both of those things actually came up in my conversations with the individuals that I reached out to give me an idea of how it is for them. To give you an example, I think most of us are aware, particularly in Pakistan, and I appreciate some of my fellow speakers have touched upon this. There has been a huge commercial, financial impact and so forth, and where you've got women who are, let's say, either the primary wage earner in a family, and I'm thinking more so really of the unskilled workers here. The impact has been really pretty catastrophic because you're dealing with people having been let go, already difficult circumstances with no real prospect of knowing when they're going to be able to come back. Some of these people have been, after years of service, been sent home with no recourse to funds, which leaves them in another, sort of a dire situation. And in addition to being the income earner in a family, they are, as again, some of my fellow speakers have touched upon, they're also usually the primary carer in the home. So, so obviously there are ramifications if you're without funds in the first instance, and then you've got to care for the family on top of that, and the situation being what it is, everybody is living in close proximity, and that, needless to say, causes some issues. Now, turning to the issue of the healthcare workers, I've seen so many stories and so much misinformation being circulated, which unfortunately, to my mind, seems to be just, the misinformation seems to be, welcomed with open arms. And this is so discouraging when you are a frontline worker, be it a healthcare worker, be it somebody who's going out into the who's doing screening, because the reality is that these individuals, these women and men, of course, they are no different to us. And they have the same fears and the same concerns. And yet, despite that, despite being in an environment in which the risks are intensified, they're still prepared to go out and do that job. whether that's working in a COVID environment within a hospital or whether that's going out in the field, the risk is still the same. And one of the common themes that I've had repeatedly shared with me is, while all the precautions are of course being taken, because these people are professionals, and you know, there's certainly no issue about PPE being provided to them and so forth, it's that mental hurdle. It's knowing that they have to go out into an area that's perhaps very vulnerable, that is a high risk area, that has reported high risk numbers of infection. And knowing all of that, and on top of that, the current heat that we have in Pakistan, you know, they're wearing all of the equipment, and that is no small task. And you've got, you know, you've got the N95 mask on, you've got the hairnets on, you've got an overall and full body covering and so forth, and goggles and everything else that you require. In the field particularly, I just want us all to sort of give that a little bit of thought. In the field, in this intense heat, for somebody to be wandering around in that kind of situation, in that kind of environment, I mean, what must that do to a person? And you know, I do want to repeat that they're still able to do this. They're still able to overcome the mental gymnastics, the fears that they have themselves, and go and do this for the greater good, actually. So it's disheartening when you hear all of this information, and there have been some stories in the press, for example, where doctors have been attacked by family members of COVID patients, or, you know, hospitals have been stormed, etc., etc. And I about that. And they all, and I have to say this really, I thought was really quite, it really made me think. They all basically said that while all of this misinformation is going on, and they are dealing with this in such a stressful time anyway, and they are grappling with their own personal fears, they bother them. So they put all of that out of their minds. They treat the patients appropriately. They conduct the screening appropriately. They follow all of the safety measures that they're supposed to follow, i.e. disposing of anything, any item which has to be, you know, which is considered hazardous and has to be disposed of immediately and so forth. So they, even in the face of sort of antagonism, they're able to overcome that and go out and deal with this, despite their own anxieties. And I have to say, I have to applaud them for that, because I'm not sure if I was having to go out on a daily basis and be confronted with, in most cases, complete and utter disbelief that such a thing exists. And I think Dr. Rafia also touched upon this idea, this general perception, which is still very real for a lot of people, that this is a made-up thing. This illness, this disease is not actually a genuine thing, and it's a myth, or whatever else. So you're dealing with all of that as a frontline worker. You're dealing with people being suspicious of you, having a mistrust of what you're doing, questioning the morality and ethics of what you're doing, and yet you're still having to conduct this, because ultimately we still need to have screening done, we still need to have testing done, and we still need to treat patients who've already contracted the illness. So that's been really fascinating for me to learn from all of them. Another thing that they had mentioned to me is, actually, it's interesting that, again, Dr. Rafia had talked about her experiences, particularly sort of approaching and around Eid. Everybody has reported an absolute, you know, horrific time in that period, where they've just been absolutely inundated with patients and people wanting to be tested and so forth. But the good news, if I can call it that, seems to be that as the harsh reality of COVID sets in, and by that, more and more people are coming to know somebody in their own inner circle who has either contracted it and recovered perhaps, or contracted it and passed away as a consequence. As that reality increases, people's attitude towards it seems to be changing. And that attitude is better, certainly in the reports that people have put to me. So, for example, relatives seem to be much more open and understanding and will ask relevant questions as to what measures can be taken once a patient has actually completed their treatment and is ready to go home. And equally, patients who were, you know, the mindset, you know, that Allah mercy, this is not in my hands, this is what has been written for me, etc. They also are now asking the right questions. So one of the things that everybody seems to echo is that, look, you know, the idea of trying to suddenly do a mass education program, sort of enlighten people about the real risks, I mean, that is ongoing. You can't listen to the radio or switch on the television without seeing that. But is that really helping? There doesn't seem to be, certainly when I go out and about, I see hardly anybody with a mask on. So what the healthcare workers did say is what you can perhaps do is take steps to limit the of this infection, and the steps are, you know, to their mind quite simple. Wear a mask. And if you don't wear a mask, there ought to be a penalty imposed. And while there has been talk about that, in reality, perhaps that implementation of penalties has not occurred. So perhaps that's something to think about. Also, one of the things is most of the governmental operations will also be aware of where the hotbed areas are. I mean, we've had 2 major cities which have had to face a strict lockdown. So when you're talking about vulnerable areas, areas that have already been identified as high-risk areas, perhaps that's the time where you have to galvanize your workforce and perhaps door-to-door in the same way as you might be doing to other environments, doing the testing and also doing the contact tracing. So I'll conclude there because I think I've rambled on for quite long enough. Essentially, you know, I do applaud their work. I think it's absolutely magnificent. And I think to be able to do your work in the face of hostility and this is nothing short of heroic. Thank you.
Thank you so much, Ms. Faiza. I would now request our speaker from Kazakhstan, Ms. Dilyara. She is the first secretary at Kazakhstan Embassy, Islamabad, to please deliver her remarks.
Assalamu alaikum, everyone. Thank you, Miss, for inviting me for such a interesting event, webinar. The last several months have not been easy not for Kazakhstan or Pakistan, but for all of the world. However, the spread of the epidemic is not slowing. In Kazakhstan, many stores are open, the work of educational center open, public transport, beauty salons, and other facilities are open from Monday to Friday and remaining closed at weekends, like in Pakistan. In new reality, people always wear masks, use sanitizers, and the number of individuals walking on the street should not exceed 3 people. 50% of our government employees will continue work remotely. But a lot of workers and big number of women, they lost their jobs, and this is not a good situation in all of the world. Coronavirus pandemic has caused a global recession. World economy are in stagnation. Incomes of about half world's working age population has declined. So that government of Kazakhstan has decided to implement several steps in order to support people avoid these new challenges. One of the good steps and the main steps is support social sphere by launching a new project on providing credit housing in the form of 5, 10, 20. It means that loans will be given for 5% with 10% of initial fee for the 20 years. Next support is national business in Kazakhstan. So women sector in women entrepreneurship in Kazakhstan consists of 55%. Women leadership position in existing small and medium-sized business are 43%. The current crisis has shown the world how important the issue of social sphere, medicine, education, social protection. The situation demonstrated that all over the world need fundamental transformation aimed at improving the quality of the care system, full-fledged technological equipment of medical facilities, and increasing the competences of medical personnel. So in our new reality, we see that the most of the medical staff who are at the front of the fight against coronavirus are women. As the Kazakh proverb says, woman in one hand shake the cradle, and with the other hand she shakes the world. In one of the interviews, the head of Kazakh Infection Disease Hospital admitted that they are at work, they are staying at work, at home several hours, only several hours, and go work to save people lives. So also they have their families, they should take care about kids and must solve different questions at home. So I agree with my previous speakers, with Mr. Ramna, with Mr. Rafia, and sorry, Miss Nigar, that they say that both gender, all families should help each other. So women should be provided by psychological support in order to be healthy, in order to be happy. So there are many similar examples in various sectors of economy. Despite this, women can manage all areas of their life at the same time, also with blessing of Allah. For me personally, COVID-19 is taught me to effective manage time because remote work requires a large concentration of attention. At the same time, I have the online classes with children, and to be, I must do several works at the same time, and it is necessary to correctly allocate time. So also I wanted to say that Pakistan policy against of pandemic is very effective. All people follow the common rules, keep social distancing, and their steps help the society stay safe. In conclusion, I want to say that all are going through. We are all going through a difficult period. The unity of our people gives us strength to move forward. The weight lifted by common effort is light. I hope that our countries will overcome this challenge as well. Thank you very much for giving me such a giving me your attention, and that I take part in the good and very effective webinar. Thank you.
Thank you so much, Ms. Sinara. Our next speaker is from China, Ms. Wang. She is a senior correspondent of the China Media Group Beijing and is working on the Asian region. Ms. Wang, I would like you to share your views with us.
Assalamualaikum, and good morning and good afternoon, my dear friends from all the different countries. And thanks for having me here. I think observing the pandemic from a female perspective is a very good topic. As a pioneer country in the fight against the pandemic, China has witnessed the important role that women have played at this critical moment. Let me share you with some numbers. Among all the medical teams sent to the front line in Wuhan, female doctors accounted for more than 60% of the total, and the female nurses account for more than 90%. I guess you have seen those pictures of the female doctors and nurses when they took off their masks with the marks on their faces because of the masks. Those photos were very impressive, which show the beauty from the inside out and the great strength of Chinese people, Chinese women especially. I think this is the positive story. Despite the female medical workers, the reality for women in other fields is much more complicated. Being a mother, I myself feel very exhausted these days as I have to work while keep an eye on my two kids who cannot go to school because of the pandemic. I know I should not complain too much. At least I still have a job. But for many other women, they are not that lucky. According to a UN report, women's unemployment risks are significantly higher than men. In China, although the increase of unemployment is related to the industry, not based on genders, women are more vulnerable to suffer. One report reveals that during the pandemic, nearly 1/3 of companies had layoffs, and female workers accounted for the majority. The industry affected most by the pandemic is the service industry, which female enjoy more opportunities for employment, such as waiters, housekeeping staff. However, most of these grassroots women are temporary workers. So once the industry comes to depression, they are also the people most likely to lose their jobs. According to a survey conducted in China, 700 grassroots women were invited to evaluate on different issues, including families, livelihood, and mental conditions under the pandemic. Among all those questionnaires, almost 70% of the participants indicated that their family income was reduced and expressed their desire to increase income, and 61% hoped to enhance their employability. Difficult times, are also moments when the social security system comes into play. In China, I guess you have know this figure, which was revealed by our Premier Li Keqiang. He said that there are 600 million people in China who just earn $140 per month. For those people who have very low income, we have more supportive policies introduced in China. For example, for those urban and rural residents who are unable to work due to the pandemic, they will enjoy a minimum living guarantee provided by the local governments. And let's take the city of Beijing as an example. People who lost their jobs during the pandemic will receive $200 per month for living. Moreover, if one is hit by the virus and faces difficulties in life, one could enjoy minimum living allowance in China as well. So in addition to these policies, more important is to stabilize employment. To this arm, the central government of China will push financial institutions to sacrifice more than 200 billion in profits this year through a series of policies such as lowering the guiding lending rates, deferring loan repayments for micro, small, and medium-sized enterprises. In short, the principle is to contain the pandemic in the first place, help companies to survive so as to create more jobs and ensure the basic income for families. What also makes me feel bad is the tense of family relations nowadays. Many cities in China have witnessed the hike of divorce rate after the darkest days of lockdown. There are different reasons behind it, including those who plan to divorce but were delayed because of the pandemic. However, if we give a second look at this, the hidden reasons are worth mentioning. First, emotional problems may occur due to the shutdown, loss of job, reduced income, and increased economic pressure. Second, negative emotions such as stress are easier to express to your closest people. Third, home isolation may lead to conflicts caused by lack of room and resources. I think the fight for toilet or maybe just the TV remote could start a war at home. So many places in China have launched online mental counseling services and legal services for women to provide support and assistance. I guess I've already talked a lot about the effects of the outbreak. Let me conclude with some positive news, which comes from a very well-known Chinese expert, Chen Wei, whose team made breakthrough in developing the vaccine recently. 3 months ago, Professor Chen Wei herself was the first person to receive a shot of experimental vaccine in China, showing how courageous and confident a Chinese lady can be. So the good news is that the initiative result proves that the vaccine is safe and effective. As you may know, 3 months later, Chinese scientists and companies have developed 6 vaccines in clinical trials, 3 of which started their 3rd stage clinical trial, and the international cooperation on clinical trial is also in progress. What's more, China has announced to the world that China will make COVID-19 vaccine a global public good when it's ready to use. So in order to make sure that some low-income and resourceless countries can have access to the vaccines, according to an optimistic estimate, the vaccine for the deadly virus may come into market by the end of this year. By that time, it will be such a release for all of us, especially for us women. So stay happy and stay healthy until the day comes. Thank you very much.
Thank you so much, Ms. Wan. Our last speaker is from Uzbekistan, Ms. Dilnoza. She's an experienced entrepreneur and business coach at Business Women Association and is working for women who want to start their business plans. She provides all the services and I welcome you. Please deliver your remarks.
Assalamu alaikum, everyone. Good afternoon, dear ladies. Thank you for inviting me. Thank you for opportunity. Right now, I'm thinking about it's so wonderful and amazing to having a cooperative with such wonderful ladies from different countries. With those countries which are very close to each other in traditions, in customs, because we are all Oriental women. As we are ladies from Central Asia, we use it to use Russian language as like second language, as business language. We are sorry about that, but I will do my best. I will do my best to explain you my opinion and make you clear. So we are now having exchange opinions and experience in our professional careers during this difficult situation, during this situation of coronavirus. Of course, we have something to tell you. Of course, we have some experience to tell you. But first of all, I would like to tell you a few words about our organization, if you don't mind. So, Business Women Association, which is founded in 1991, we have 14,000 women membership community in all regions of our country. The purpose of the association is to expand and protect the economic and social rights of women, to support their entrepreneurial and social initiatives, to help ensure the use of financial and information resources, also to create favorable conditions for women's participation in development reforms, strengthening the climate of mutual trust and partnership. The introduction of innovative educational
Hello.
Sorry.
Hello.
Hello.
Sorry, I think there was a discussion from one of our participants. You can carry on now.
Shall I continue?
Yes.
Also, the main purpose of this organization also to create favorable conditions for women's participations and development reforms, and the introduction of innovative educational programs, increasing the competitiveness of women's labor through retraining and advanced training. Members of associations are entrepreneurs in different areas, but many of them are from the area of textile industry. So, as my main task in this organization is teaching women who is starting their business assistance with problem solving in the way to improving their businesses, to help them draw up a business plan, which is very important in business, the introduction of innovative educational programs. But from now, I'm going to tell you about interesting thing which is happened during this problem coronavirus situation in during the time quarantine. So we are used to teach women who entrepreneurs, women who has a manufacture, who has a production. We are used teach only in women entrepreneurs. For example, now we are having a discussion, we are having exchange opinions with the people from another country, right now. But we are all women. We are all women from different professional area. We are used to found most important in life to get to be busy in our professional jobs, in our professional deeds. But that's why sometimes we forget about our main tasks in the life, our main tasks in at home. That's why we remember it about program which we planned to do a few years ago. It was an initiative of women who sits at home, housekeepers, housewives. But we use it to teach. We use it to found most important to teach only women's entrepreneurs. But there are housewives also. There are housekeepers also, which gets main part of in our society, as we are Oriental women. We are all women. That's why we discussed to do our program about family budget, which considers how to manage family budgets, rational use incomes of family, to control expenses. These things are most important in our life too. It's true that we are first of all, we are women. That's why we decided to do this program to teach the women, housewomen, because of situation of coronavirus. We are all become to housewives. How to manage family budgets, rational use incomes. It was, how to say, it was so amazing, and it was a very good. It was very good way to distract the women who was worrying about losses, about increasing problems in their business. It's not secret that many of women entrepreneurs also worried about their losses. They had many difficult situations in their professional affairs, in the business. That's why we found a way how to distract them. And so we made online webinar to teach them how to operate family budgets. That was the main thing that why I had to tell you. Thank you very much.
Thank you, Mr. Noza. Dear participants, I would request Ms. Kana once again to deliver her remarks, as we could not hear her. We were unable to hear her due to connectivity issues. So I would request her to please reconnect and deliver her remarks again.
Салам алейкум, урматтуу айымдар. Тема нашей конференции является очень интересной и нужной.
Good afternoon, our colleagues. I think that our theme is very important in nowadays.
Те доклады, которые до этого прозвучали, показали, что у нас очень много общего. Женщины в Кыргызстане до и после COVID.
Just a minute. Okay, we're ready soon.
Ma'am, would you like us to share the screen for you if you want to present the presentation?
Yes, we want, but
okay, we'll share the screen for you.
Could you see this presentation?
We can see it.
Женщины в Кыргызстане до и после COVID. Доля женщин населения страны составляет 50,4%, мужчин 49,6%. Женщины среди государственных служащих занимают 40,3%. Положение женщин при пандемии, перегруженность системы здравоохранения, образования, где большинство составляют женщины и девушки, привели к ухудшению их положения. Раньше говорили о тройной нагрузке. Во время пандемии возросла в разы, работали круглосуточно. Зачастую осваивали новые направления, что также вело к психологической нагрузке. Здесь показаны слайды, где женщины на всех направлениях и вот на всех участках здравоохранения, образования, социальной безопасности. Вы видите на фотографиях эти данные. За последний год почти каждая пятая женщина в мире подверглась насилию. И в настоящее время многие из этих женщин находятся дома вместе со своими насильниками, как в ловушке, бесплодно пытаясь получить доступ к урезаемым и ограничиваемым услугам. На это обратил свое внимание генеральный секретарь ООН Антонио Гутерриш. В Кыргызстане количество фактов домашнего насилия только за первый квартал 2020 года возросло до 65%. Причем домашнее насилие – это не только издевательство. В новом году на почве семейного насилия было убито 7 женщин. В режиме чрезвычайного положения семейное насилие выросло в 2 раза. Генеральный секретарь ООН, он призвал, что жизненно важно обеспечить гендерное равенство и защитить права женщин во время пандемии. И призвал правительство уделять женщинам и девочкам приоритетное внимание в рамках своих усилий по восстановлению после COVID-19. Для этого женщинам в первую очередь должна быть отведена роль лидерам, имеющих равную представленность и равные полномочия на принятие решений. Он также призвал правительство признать, что неоплачиваемый женский труд – это огромный и бесценный вклад в экономику. Что необходимо сделать? Во-первых, интересы женщин и девочек должны лежать в основе всех решений, определяющих планы и реальность во время пандемии. Во-вторых, необходимо повышать осведомленность женщин, подвергшихся насилию, о возможностях и способах обращения за поддержкой. Проводить работу с мужчинами и мальчиками с целью ликвидации гендерных стереотипов. Необходимо изыскать возможности для учета неоплачиваемой работы по уходу и социально-экономическим нагрузкам.
И, наконец, необходимо обеспечить женщинам равную представленность и равные полномочия на уровне принятия решений. Спасибо за внимание.
Thank you for your attention. Miss, thank you for your attention, everybody.
Thank you so much for such an informative presentation, Ms. Pana. We'll now proceed towards the interactive and question-answer session. I would request everyone to please be brief and relevant to the subject. So first we have a question from Ms. Zahra for Dr. Rafia. Ms. Zahra, unmute yourself and ask your question.
Yes,
Ms. Zahra, please ask the question you have for Ms.
My question is to Dr. Rafia Rafi, that how can parents ensure a healthy environment for their children during the pandemic?
Indeed, a very interesting question. We have been working with children also. The first thing that is very important is that maintain the routine for the children. What is happening is that they do not take proper rest. They are awake for longer hours. They are unable to wake up in the morning. So the sleep disturbance is there. Maintain the proper schedule for the children. Like if they get up around 7 in the morning, you can just increase it and schedule their time. Every hour should be scheduled. They should know that they have to study, they have to do other activities, and also involve them in a number of activities. Don't ask them to just sit in front of the television or their tab and just be on their own. So you have to put in a lot of effort. If they are very young kids, you can divide their time as a timetable you can maintain for them. Their study time, their eating time, their play time, you have to maintain separate play stations for these children. If you have a comparatively bigger home, you can have different play areas for the children so that they can feel that they are in different places, even if they cannot go out. And then if they are a bit older, you can connect them with the families through Zoom and through things like this, and you can productively involve them in a number of things. But the foremost thing is that you have to take proper care of their sleep habit as well as their eating habits. These are the two things that are affecting the children mentally. And also be aware that these days the children are into excessive gaming, like these PUBG and these games. They are creating a lot of disturbance for the children. So you have to be very vigilant and see what your child is looking and what games the children are playing, so that they don't get addicted to television or these games. So you have to devise according to the age of your child the activities, and you don't have to leave the children all by themselves, because this is a very critical period in which the mental health issues, the emotional exhaustion, the children cannot tell a lot. I hope I've answered your question.
Thank you so much, Ma'am Rafia. We have another question from Nashid. He's a law student and he has a question from Ms. Faiza Sheikh.
Assalamu alaikum.
Walaikum assalam.
I need to correct one thing. I'm a practicing lawyer, not a law student. I have a question for Faiza Sheikh. As the whole world is going through the corona season and domestic violence is on the rise, and Pakistan government has not done sufficient for the women. So has there been any legislation in Great Britain to protect women, particularly house women, during this pandemic?
That's an interesting question, actually. So in England, as in Pakistan, there is legislation which you may be aware already exists in respect of domestic violence specifically. The challenge regards to COVID, particularly as some of my fellow speakers have mentioned, is the fact that ordinarily when there's an instance or ongoing, as domestic violence usually is, then in normal life, there is some scope for the person who is being abused to go out elsewhere of the home and be able to make a call. That current state, because we're all on lockdown, is simply not available, right? So while I'm unaware of any specific pieces of legislation in England and Wales that have addressed the specific points of COVID, and I'm happy to check that for you. What I do know is that the issue of an increase in domestic violence has been recognized pretty much everywhere globally, not just in, and certainly in that particular jurisdiction, there have been measures and changes and recommendations made. So even though, let's say for argument's sake, they have not yet been implemented into statute, certain measures and techniques and methodologies shared quite widely, either through government or through the services that address those specific issues, women's refuges and so forth. Any agencies that work in domestic violence, they have also circulated best practice in these times. I hope that answers your question.
Yes, thank you. Thank you.
Thank you, Ms. Faiza Sheikh. Question from Ms. Lareeb Hassan. She's a digital media executive at CGSS. She has a question for Ms. Nigar.
Greetings, everyone. I hope I'm audible. Ma'am, my question is that what are the policy options in your country for women who are working in business? As you said that you've been helping women entrepreneurs in Uzbekistan. So what are the options for them? And have you started any digital advocacy program to help them in their business related issues?
Thank you for your question. If I heard you right, you're asking about the internship policies for women?
Yes, and if that has been affected by the pandemic and the lockdown.
Yeah, I would like to talk about from the perspective of our network. So why we decided to launch this project first. We just wanted to, it's like it was in our strategy as a strategy of the State Committee on Work with Diaspora of the Republic of Azerbaijan. We wanted to bond Azerbaijan diaspora women around the world together. And it was, we were like nourishing this idea for a long period of time. And it just happened that the launch of the project, it was decided to make it right now. So I feel like that was a great opportunity because we managed to gather the women and establish the network. So we're launching different webinars, inviting women who, for instance, they're the organizational owners, or they can be a businesswoman as well. And then they share their own topic, the topic that they want to talk about. And when I always invite women to the webinars, I ask them what is the topic they want to speak about, what is the issue they want to highlight, and they share their own insights with us. Then we discuss and the topic comes up. So it can be anything, it can be about internship as well. And as a process, it's also about networking, because we have the participants at the webinars and they ask questions, they exchange opinion, they share their contacts in the chat. So that's how we're building the network and help women to support each other. It can be any topic, not just the internship. I hope that I answered your question.
Yes, thank you, Ms. Nigar.
Thanks a lot.
I would like to thank all the participants in our webinar. Just to mention that CGSS has taken a remarkable initiative titled as the platform. This project envisions to create a dynamic and skillful human resource through constructive guidance and trainings and awareness programs. These webinars will play a significant role in creating awareness and enlightening our audience, especially the youth, about various important social issues. So we'll continue to have such productive sessions to create a better society around us. With this, I invite Ms. Mehreen, the Director of CGSS, to please deliver the closing remarks.
Thank you very much, all the panelists and participants of the webinar. This was such an honor to have women from different countries. Being a director of Center for Global and Strategic Studies, I invite you all to join the next webinars, as Ms. Menahil mentioned about the initiative taken by CGSS. It will provide awareness and information related to different sectors, different social issues, international issues, national issues, and especially for youth. So thank you very much once again. And this webinar was such a wonderful, as women are the key pillars of the society. So we can and we share our contribution towards our society. Thank you all.